Okay, good afternoon, everyone. Thank you for joining. We'll give everyone a minute to get settled and then we'll get started. Okay, well, let's just jump right in. Hello, my name's Meg McMahon. I'm the Associate Director with the Canadian Institutes of Health Research's Institute of Health Services and Policy Research, and a recent PhD graduate of the Institute of Health Policy Management and Evaluation. And I am delighted to welcome you to today's COVID-19 webinar, which focuses on the economic implications of the COVID-19 pandemic. This marks the 6th webinar in a series hosted by the University of Toronto's Dalla School of Public Health in partnership with the Institute of Health Policy Management and Evaluation. The school and IHPME are hubs of health systems experts and thought leaders who are making positive impact on health and health systems locally and globally. The school and IHPME have a proud history of health system innovation, with faculty and graduates leading cutting-edge science, translating research into practice, and improving the access, quality, and equity of care. I'll very shortly introduce the panelists and the focus of today's webinar, but first I'd like to acknowledge the land on which the University of Toronto operates. For thousands of years, it's been the traditional land of Indigenous peoples and remains home for the Indigenous people across Turtle Island. We are grateful to have the opportunity to work on this land, and we honor Indigenous peoples and their ancestors, their knowledge, and their resources. Today, as we as webinar participants are on many different lands, and within this virtual context of connecting, I invite you to take a minute to reflect on the land on which you live and work. I'll start off with a few housekeeping notes before we begin. We'll do our best to address as many questions as possible, and we'll do so after the introductory presentations by our panelists. To ask a question of the panelists, please use the Q&A button at the bottom of the Zoom window and type in your question. For those on social media, please share your thoughts and questions with us and with the broader community using the hashtag COVID-19DLSPH. And afterwards, the webinar will be available on the IHPME and Lana School of Public Health YouTube channel. And so without further ado, it's my pleasure to welcome you to today's webinar, which focuses on the critically important issue of the economic implications of the COVID-19 pandemic and resuming economic activity. The multifaceted effects of COVID-19 pandemic are staggering, including a global economic crisis that was unexpected and that will have far-reaching impact. While shutting down the economy was not a primary goal of the government's COVID-19 pandemic response, it was a consequence, arguably an unavoidable consequence, of policies that were aimed at reducing contact among individuals to protect population health. The pandemic isn't an economic problem in the sense that a hyperinflation would be, but the decision to impose restrictions on interpersonal contact necessarily entailed closing a range of workplaces and schools, triggering significant economic implications on work and employment. While the timing and details of these and other restrictions have differed across jurisdictions, most have imposed some degree of shutdown. When shutdown policies were introduced, there were references to the economy being put on pause, to its bouncing back once the crisis had passed, along with a general sense that so long as the Bank of Canada could continue printing money, no real damage would be done. But is this correct? While epidemiological models abound and are multiplying at a rapid clip, there has been remarkably little formal modeling of the interaction among the epidemic, the economy, and the various policies which have been introduced. Today's webinar will feature discussion on how to combine economic and epidemiological modeling in an integrated way to give policymakers some insight and guidance on what the major economic implications have been and will be down the road, what policies and strategies can help to mitigate the short and long-term consequences of the pandemic, how governments, businesses, and people can plan for resuming economic activity, and what to consider and learn from this COVID-19 crisis when preparing for future pandemics. This is an important conversation to have, particularly at this point in time when countries have started to reopen their economies and where here in Canada, certain provinces have begun to announce their plans to do the same. What can we learn from progress elsewhere about how and when to reopen our economies in the wake of the pandemic? With this brief background, it's my great pleasure to introduce our panelists today. Joining us from Toronto and Guelph are economists Dr. Audrey Laporte, Dr. Brian Ferguson, and Adrienne Rowett-Das. Dr. Laporte is a professor and director in the Institute of Health Policy Management and Evaluation. She's the director of the Canadian Centre for Health Economics, president-elect of the International Health Economics Association, and associate editor of Health Economics. She was also my phenomenal and incredibly brilliant PhD thesis supervisor. Dr. Ferguson is a professor of economics at the University of Guelph, faculty associate of the Canadian Centre for Health Economics, and holds a status appointment with IHPME. Adrian Rowett-Das is a doctoral candidate at IHPME, the research coordinator at the Canadian Centre for Health Economics, and holds a master's in economics from the University of Guelph. We're in excellent hands for today's webinar. Instead of formal introductory presentations by each panelist, as has been in the past in the webinars so far, we're going to take a dialogue approach, kicking it off with a few directed questions and then opening it up with questions from you. So let's get started. First question, over to you, Dr. Laporte. How serious have the restrictions been in the Canadian context? We hear a lot about workplaces being shut down, for example, yet the jump in the unemployment rate from February to March was only from 5.5% to 7.8%, and the Canadian unemployment rate has been that high before. What do we actually know about the severity of the economic consequences of this shutdown?
Right, thank you, Megan. Well, the first thing that one needs to remember is that Canadian economic data come in with a lag, which is why we're talking about March unemployment figures at the end of April. And the labor force survey, which is where the unemployment rate figures come from, is done during one particular week in a month. And the March survey was done before the shutdown had taken full effect. So the jump from 5.5 to 7.8% in the unemployment rate doesn't sound enormous, but it represents just over 1 million people losing their jobs between 1 month and the next. And since those jobs were lost at the point in time when the shutdown began, what we're really talking about is over 1 million people losing their jobs within the span of a few days. So the next round of unemployment data will be more striking yet if the American experience is anything to go by. In the US, between mid-March and mid-April, more than 26 million people filed for unemployment insurance. The New York Times reckoned that that's equivalent to everyone in about 25 states losing their jobs. So one also has to remember that a fair number of people who are still technically employed, but they're not putting in any hours, which means they're not earning. And there's also a significant number of people who've had their hours cut quite significantly. So the numbers for Canada in that regard are that, yes, we have over 1 million people lost their jobs, but another 1.3 million or so were still technically employed, but not actually working. And at least another 800,000 had their hours significantly cut. In fact, the economist Philip Cross has calculated that if you take all of that into account, this amounts to a reduction in the labor input in Canada over this period of about 25%.
That's obviously a lot of employment impact. But the federal government regularly announces programs to make payments to people who have been laid off, supported by the Bank of Canada's purchases of federal and provincial government debt. Tell us why the COVID-related employment impact matters and for whom.
Okay, there's a misconception. I think that so long as the Bank of Canada can print $100 bills for the government to hand out, that everything is going to be fine. But cash is useful only so long as there's stuff you can buy with it. Otherwise, you might as well just use it as wallpaper. If the amount of labor employed falls by 25%, the amount of stuff that's produced in the economy will fall by 25%, and real incomes will fall by 25%. And that's regardless of how much government money gets printed and handed out. And moreover, I think it's very important to remember that when we say real national income drops by 25%, say, it's not a matter of everyone taking the hit equally. The disadvantaged, such as low-income workers, will be hit much, much harder than people whose paychecks continue to come in through this.
Thanks, Dr. Laporte. So I'd like to probe you a little bit on that. We hear a lot in the news that we're in a situation in which we're faced with choosing between income and human lives. And we know, as you just stated, that the disadvantaged populations are disproportionately affected by COVID-19. Will welfare programs and special assistance provide the sort of short-run support that people need to get through this?
I think we've gotten too much into the habit of treating the choice or framing the choice as income versus lives. It's important to realize that a long-term reduction in income will have its own health consequences. The key difference is that those consequences will be spread out over future years, whereas the COVID deaths are appearing now. And it's well established that income goes along with better health at the individual level, and in many ways, even more so at the level of population health. And deprivation, which is what we are talking about on a large scale here, has serious consequences for both mental and physical health, especially as regards chronic illness. The literature on health impacts of economic downturns shows that they will have significant consequences on people's health outcomes, certainly in the short run, but over the longer term as well. In fact, evidence from the 2008 financial crisis from the UK estimated that a 1% decline in the employment rate led to a 2% increase in the prevalence of chronic illness, with much larger estimated effects for mental health. And unfortunately, it's looking as though the employment shock that we are going to experience due to COVID may be much larger than what we experienced with the 2008 financial crisis. And so we may expect, if this continues for much longer, to find large long-run health effects. And again, it's important, I think, to recognize that those effects are likely to be experienced much more profoundly by disadvantaged populations, because they will have tended on average to have lower health status even before this crisis hit.
So, Dr. Laporte, are there policies or measures that are needed to support the disadvantaged that would recognize the differential implications of COVID-19 on different populations and population subgroups?
There are probably two types of policies that are going to come into play in this situation. One is, a set of stabilization actions, basically to stop things from getting worse. Here, we've already seen steps taken. The Bank of Canada has been buying provincial and federal government bonds in the primary markets, basically printing money to give directly to governments to finance the spending that they're having to do right now. We've seen the introduction of the emergency response benefit. I believe about 6.8 million people have already signed up for that. That one, is designed to give $500 per week for up to 16 weeks to people who've lost their jobs due to COVID. The Business Development Bank has given no interest loans. There's been subsidies to payroll and rent. And all of these policies are really designed to maintain cash flow for businesses so they can meet their bills in the short run, because credit is really important, especially for small and medium-sized businesses. So this is where we're living right now, and justifiably so. But we'll have to shift to introduce a different category, a second category of policy, which is geared to stimulus. because ultimately the solution is getting the economy back on its feet. And so in that regard, we're looking at things like the old standby of infrastructure spending. And of course, there, naturally, we would want to prioritize shovel-ready projects. But there's likely still to be a lag before those really take root. And secondly, as regards this particular crisis, it's unlikely that those projects would create new jobs for women and other groups who have lost their jobs in the service sector. So we'll have to look to policies that are designed to give a boost to the recovering service and related sectors. One might consider, for example, a reduction in the GST to reduce consumer prices. But my sense is that we'd still like to have a safety net in place for people who may still be engaged in the labor market, but who have been severely affected. One might consider a negative income tax, for example. So if individuals' incomes fall below a certain taxable level, they would receive a payment from the government.
Thanks, Dr. Laporte. I'm going to turn it over to Dr. Ferguson now with a question for you. Reference has been made to a long-term reduction in income, but if we shut down the economy long enough to defeat this particular coronavirus, can't fiscal and monetary stimulus bring the economy roaring back? Is it likely that we have a V-shaped recovery, a deep drop in economic activity while the restrictions are in place, followed by an equally rapid recovery, perhaps helped along by government spending and easy money policies?
Yeah, when this business first started, you heard people talking about this notion of sort of pressing the pause button on the economy and then pressing play again when all of this was over. Nobody much is talking that way anymore. The chairman of the Federal Reserve in the US the other day said that he is expecting this to be long, drawn out, a slow and painful recovery. The arguments that were made at that time initially were that this was going to be a demand deficiency recession, that spending would collapse during the shutdown, but that once the restrictions were lifted, you'd have people with sort of unwanted savings with cash burning a hole in their pocket. They would splurge, they would catch up on the spending they had not been able to do during the recession, and the economy would pick up. Key assumption in that is that the economy's productive capacity would be unimpaired, so that at the first signs of increased demand, employers could just call laid off workers back in and put them back to work immediately. That might happen if the shutdown is sufficiently brief, but that's looking less and less likely. You know, you've had politicians talking casually about shutting down for 18 months. You've had others saying we'll just have to stay under restrictions until we get a vaccine, whenever that is. If the shutdown lasts in a big way for more than a couple of months at most, we're going to shift from a demand deficient recession to one in which the economy's productive capacity really is impaired, and small business will be the first to go. Most small businesses don't have more than a couple of months financial cushion, and you know, even government financial aid can't stretch that out indefinitely. If they see a longer shutdown ahead of them, and even worse, if they think they're in for an indefinite shutdown, a lot of small businesses are going to decide that bankruptcy is better than hanging on and building up debt. And when that happens, their productive capacity is pulled offline, and an increase in demand isn't going to bring it back. But without that capacity, there won't be jobs to call the unemployed back into. So if we get into that kind of situation, we're essentially pushing the economy into a long-term depression, and recovery will be extremely slow.
That sounds a bit frightening. So how deep a depression are we talking about here?
Well, there are epidemiological models which say that in order to kind of beat the virus, we're essentially going to have to go on job sharing, meaning that 1 week, half of us would be at work. The next week, that half of us would be in isolation, and the other half of us would be at work. And the idea behind those from the epidemiological point of view is if you happen to get infected during the week when you're at work, in the week when you're in isolation, if you like, at home, you're going to be isolated, socially distanced long enough to get past the infectious stage. But if you think about that, a 1 week on, 1 week off pattern for everybody would mean running the economy at half speed until basically there was no more risk of the epidemic reviving. And that would mean cutting national income in half pretty much indefinitely.
So what should we do? Was the shutdown strategy wrong from the beginning?
No, given that the information we thought we had at the beginning of all of this business about things like person-to-person transmission, severity, infectiousness, given that all of that turned out to be pretty much entirely wrong, there was really nothing much else that we could have done once we discovered that the virus was here. What we can't do, it's very important that we not do, is get into the habit of thinking of shutdown as an optimal long-run solution. We've acquired a lot more information about the nature of the problem since all this started. We got a much better idea of the relative risk faced by different groups. We can say that the older segment of the population's at highest risk of a severe episode if they catch the virus. And we can ask whether shutting down half the economy is really the best way to protect that group. We need to move from the sort of blunt instrument that was really our only option in the early days to targeted policies. We have to recognize that we're never going to have the kind of testing capacity that some reopening plans call for. So we should do things like focus on testing the staff at seniors' homes at the beginning of every shift to kind of do our damnedest to keep the virus out of those locations. Do the same in hospitals, anywhere where there's a concentration of high-risk individuals. In terms of bringing the mortality rate down, we need to be targeting our resources to wherever they'll have the greatest incremental impact.
Thanks, Dr. Ferguson. Dr. Laporte, there was news written by Michael Wolfson yesterday in the Globe and Mail about targeted testing and prioritizing our testing. But what about people in other workplaces? If we're devoting our testing in seniors' homes, long-term care homes, and hospitals, what about folks in other places?
Good question. When the public health experts deem that we are in a position to begin broader reopening because a certain set of criteria have been met, we're going to have to make sure that people are aware of the latest information on the risks that they face in different activities and in different settings. For a lot of younger, healthier people, the risks are relatively low. We can contemplate the possibility of going from workplaces that are currently completely shut down, where we're subsidizing on an emergency basis the wage bills, to one where we may allow them to reopen, but continue to use public funds to subsidize high-risk workers to stay home. It would still mean operating at lower productivity than in the past, but that's better than shutting down long-term.
So it wouldn't be a flipping the switch on type of strategy?
By no means. I think, it's going to be more of a very careful, graduated, slow, methodical turning of the dial. Clearly, some areas, some activities, such as large sporting events and concerts, are likely to have to remain on pause for much longer than others. But we might, for example, consider reopening restaurants with physical distancing requirements. I read that Lithuania is allowing restaurants to move tables outside, for example, to facilitate the distancing piece. So essentially what we have to do is that we are now going to have to recognize trade-offs. And we know that if we keep everything shut down, we don't just lose income in the short run. We are building up economic and public health problems for the longer run, which risks magnifying any existing income inequalities and disparities. It's clear that the shutdown was pretty much the only route we could go under the circumstances. But coming out of it, we're going to need to make use of the information that we've gleaned while in it about the nature of the epidemic. As Brian noted, we're probably going to have to accept that we're not going to have all of the testing capacity or capability that we would have liked to have had, and probably accept that it might be a good long while before a vaccine comes available. So the challenge for policymakers is that they have to sort out the conditions for an optimal reopening trajectory, recognizing that while nobody likes the idea, compromises and trade-offs are going to have to be made. We're probably also going to have to recognize that there is going to be a need for support to be provided, particularly to vulnerable groups, well beyond the initial reopening period. So not just in the exit period, but through to support a post-pandemic economic recovery. So perhaps the only bright spot here in all of this is that it's we, not the virus, that gets to be the ones deciding which trajectory we're going to follow.
And can you comment on what that trajectory is likely to look like?
Again, that's going to depend very much on what the public health experts are able to put together with the data that they have to this point about things like the relative riskiness of different activities and different sites, different places. So, allowing people to walk their dogs or walk in parks so long as they maintain proper separation probably involves a relatively low risk of contagion based on the information that we have gathered to this point. But thankfully, we don't just have to rely on the information that we've acquired from our own immediate experience. Other countries are ahead of us in the progress of the virus or in initiating the reopening sooner. And it's not to say that we don't have some good examples locally. There was a recent article in the Globe which highlighted this tragic statistic that 60% of the COVID deaths in Ontario have occurred in our long-term care facilities. But they also highlighted a strategy adopted in Kingston, where in the very early days of this, they redeployed the inspectors that had been inspecting restaurants to go out to their long-term care homes to ensure that they were complying with public health guidelines vis-a-vis COVID. And as a consequence, they have recorded no deaths due to COVID in their long-term care facilities. So are there lessons from that policy, which was introduced in the shutdown phase, that would be useful when we think about reopening? France has talked about a staged reopening as well, but they're looking at doing it differentially by region. So some regions are going to be opening up much more slowly than others. They're also mandating masks for schools and for people using public transportation, and providing washable masks to the vulnerable. So a lot to be learned from their experience. And in Quebec, it looks as though they're planning for a reopening to begin in early May with retail and manufacturing and construction. So we can use experiences in other jurisdictions to basically do an incremental cost effectiveness analysis in reverse to address the question, which restrictions can we ease with least probability of causing a major upswing in infections?
And there is, I will plug, a current CIHR rapid response funding opportunity open right now with opportunity for exactly that type of work. But I'm going to shift over to you, Dr. Ferguson, and ask, we've talked a lot about the economic consequences of the lockdown itself, but what about the direct economic consequences of the epidemic? Is this the sort of thing which can be incorporated into models of the overall economy, macroeconomic models? For a start, is the downturn we're going into now somehow fundamentally different from other downturns we've gone through over the years?
Well, in one sense, all downturns are unique, but most of the downturns we've gone through, since the Second World War have been demand deficient downturns. Macroeconomic activity, meaning aggregate economic activity, is basically kind of a self-supporting cycle. Aggregate spending, which we call aggregate demand, supports aggregate production, which generates aggregate income, which supports aggregate demand. Most of the downturns then that we've experienced since the Second World War occurred when part of the cycle got disrupted. Demand fell off for some reason or other. That caused employment to fall, which caused income to fall, which meant that support for demand dropped further. And we settled into an equilibrium in which we weren't using all of the resources available to us. That's not a self-correcting situation, but it can be countered by increased government spending to boost demand and move the system back to its previous level of activity.
So would increased government spending not help now?
Not as much as many people think, but if we lift the restrictions fairly quickly, we could have a fairly good demand-driven recovery. It'll have to be supported by government spending. That'll create issues about managing the national debt in the future. But at the moment, there's probably a pretty good demand for very safe financial assets. So there's probably scope for the federal government in particular to borrow long-term at pretty low interest rates.
That doesn't sound as if it involves any special modeling.
That wouldn't, but there are other aspects of the situation that would, and they're mostly issues of productive capacity. So even if the episode turns out to be relatively short-lived, we're going to see increased production costs because, testing and using protective gear are going to become standard. We're going to see some reduction in productivity because we're going to be telling people to stay home, if they have even a slight cough. If it drags on long enough for us to have sufficient or significant, rather, business bankruptcies, the reduction in capacity is going to put us back in the kind of stagflation situation we experienced in the 1980s. And in that kind of situation, it's always the weakest members of society who suffer most.
And is this where there would be significant modeling challenges?
There and in longer term modeling. What's the effect of this likely to be on long-term economic growth, especially if we're going to be experiencing repeated waves of infection into the future? What we're looking at here, in a sense, is a really, really involved burden of illness study. We're talking about how the epidemic feeds into the economy as a whole. To look at that properly, we'd need to have a better sense of which sectors are going to be most severely affected in terms of reduced productivity. We can get a pretty good idea of that from input-output analysis. And because productivity would be affected for some time to come, we're probably looking at reductions in national saving and investment. Those, in turn, will reduce economic growth in the longer run. And that's a reduction in growth relative to the pretty anemic growth we've had since the 2008 crash. There are, for example, epidemiological models which say that if your sort of social distancing in the first stage is very successful in stopping the spread of the virus, then if there's a second wave, that second wave will be even bigger than the first wave. You kind of damp it down initially and it kind of pops up again later on. So that's the kind of thing we're looking at. We're looking at how do we modify large-scale economic growth models to allow not just for a single shock to population health, but in a way that lets us link the dynamics of the epidemic to economic dynamics, and in a way that would let us link different epidemiological models' predictions into a macroeconomic growth model.
So Dr. Laporte, is that conceptually feasible?
Yes, it is ambitious, but as it happens, we have a graduate student in IHPME whose master's research involves incorporating population health, epidemiological data into a model of economic growth. Now, having said that, I'm sure when she started out, she wasn't expecting to have such a dramatic illustration of why that's an interesting research question. We're also contemplating putting together a short course or workshop in IHPME in the fall on how to build in the information coming out of these fantastic epidemiology models, incorporating them into models of economic growth, using an analysis of this COVID episode as a case study.
Well, I suspect you'll have high demand for that course. At this point in time, I'd like to thank you both for your incredibly insightful comments and for what has been a truly fascinating and important discussion. I'll turn it over to my colleague Adrian to open this up for Q&A with you, the audience, and remind you to please, if you haven't already, to submit your questions through the Q&A function. So Adrian, over to you.
Thank you, Megan, and thank you to our audience for your questions so far. The first question we have from our audience reads, what role does technology play in the ability of people to continue working during a long-term COVID-19 impact? Many organizations have moved their workforce to working from home, and therefore not all workers would need to go onto a job share program?
I'll take that one. I mean, it's quite true. At the university, certainly, we had our doubts about going online, and, we had to make that happen along with our students and faculty in short order. And certainly there is going to be, differential impacts of the distancing and not being able to go to the work site across different kinds of work settings. But perhaps more importantly, there are going to be differential impacts across members of the population, particularly in the service sectors, hospitality. The number of these have been so hard hit because of the limits to technology in facilitating their continued operation. And so we have to recognize, including for children, we've gone to online learning, but children, depending on their socioeconomic background, have different quality of learning environment, different access to these technologies. And we have to recognize that that's going to risk reinforcing and possibly even exacerbating existing disparities.
Yeah, thank you, Audrey. So the next question, how would you think of Iceland's experience, massive testing, contact tracing, and isolation using policy and detectives, but keeping schools and restaurants open? The epidemic is still under control. Thanks.
Yeah, you've got a lot of different circumstances in different places, and they're all unique, and Iceland is as unique and weird as any of the others because they actually continued to allow, foreign visitors into the country when they were doing all of that stuff about restricting and testing and so on and so forth. And remember too, they've got this massive population genetic database that they've been putting together. It's going to be interesting to see what comes out of Iceland, but more broadly, this is probably going to be the kind of most thoroughly researched pandemic in human history just because of the data we've got. You've got the Johns Hopkins database about deaths and infections and so on in all kinds of different countries. You've got the Oxford University database about the various policies that different countries have implemented. What you're going to be able to do is take all of that data, use the policy information about the nature and the timing of the policy to control statistically for the effect of different degrees of lockdown, for example, and back out a lot more information than we've ever had in the past about the natural dynamics of the epidemic itself. And somewhere in there, we're going to have to figure out why exactly, Iceland did what Iceland did, and whether it was, Iceland's testing and tracing policy, which had a tremendous effect, which a lot of people think, or whether Iceland just got lucky. There's going to be an awful lot of research done on that stuff in the future.
Thank you, Brian. The next question, are there certain industries that will be permanently changed? The airline industry comes to mind as the world learns to have effective meetings virtually, lessening the need for business travel. Is this industry at particular risk?
Well, I think that, in reading sort of what the economics community has been saying, the predictions for a number of sectors are not looking good. They are using words like structural change, and that this epidemic may have sped up some structural changes that were expected to materialize over time, but has compressed that time. And that's we've talked about, in policy circles about deaths of despair, and Case and Angus Deaton and their work in the US. And we were having those conversations when the economy was humming along. The concern about individuals who are adversely affected when an economy moves through structural changes. In some cases, it's modernizing from one form of economic activity to another. Here, we've had a potentially very, very rapid forced structural change. And I think that means that there are going to be a number of sectors beyond transportation affected. And as a consequence, there are going to be, other additional segments of the population that will have long run and negative consequences and as a result.
There are going to be definite sectors. The service sector is going to be slow to recover. I'm not sure that, transportation, the airline transportation will be changed permanently, but people are going to be very cautious about getting on a plane for a while, no question about that. The other thing we've got to look at is the private debt burden in various sectors of the economy. We hear a lot about accumulation of public debt, of government debt, but there are kind of sectors of the economy in which large firms have amassed large debt loads because they were expecting a certain level of growth. And if they actually got that level of growth, they would be able to support the debt. The debt was frequently for things like investment that you actually want them to be doing. But when you get into a situation where you've been doing your long-term borrowing planning on the basis of an expectation about how your revenues are going to behave in the future, and those revenues tank, then you can get a very fundamental structural problem, which is not so much a function of the industry itself as it is with kind of the way the industry is financed.
Thank you, Brian. So Dr. Laporte described an example where restaurant inspectors were redeployed as LTC inspectors. What impact could redeploying unemployed workers to industries facing higher demand, example, grocery or delivery service, have on the economic challenge? And whose responsibility is this, individual workers or government?
Well, certainly a lot of workers, driven in part by necessity, have had to redeploy themselves. They may have had one type of service job which came to an end because of the crisis, and they've had to redeploy as a Uber Eats delivery person. So one could argue that in the short run this mitigates their loss of income. But it's going to be a combination. There are going to be people who can't make that effect that transition to buffer the negative effects. So I've mentioned some of the sort of emergency relief, but then there's the solution here in the longer run is that we have to get the economy back on its feet so that people can have jobs, because we can't over a very, very long run, we can't maintain these policies which that I've talked about, whose main function is stabilization. They're not that toolkit doesn't really extend to the stimulus piece, where in that regard, that's the government has an important role to play in terms of trying to promote policies that will give a boost, give some stimulus to create new jobs.
And also, when you're talking about some of the sort of reallocation, I mean, firms have done it themselves. You've got people like Loblaws, which have been hiring as many people as they could possibly get to act as distant shoppers for clients of Loblaws who can't get to the supermarket, who don't want to risk getting to the supermarket. So there's kind of an automatic dynamic going on there. But there's a limit to how much of that redeployment you can do. You know, there's a lot of talk about redeploying unemployed workers to go into agricultural sectors that are facing major problems. But that requires a certain amount of training and skill, and it's not, you know, a seamless process by any means.
Thank you, Audrey and Brian. So next question, approximately how long would an economic recovery plan in Canada? There's a concern in clinical circles that if the economy recovers, it'll be challenging to control the virus and flatten the curve. What should the role of healthcare professionals and health economists be during economic recovery and balancing the health and well-being of the population with an optimal economic recovery plan?
Well, I would say that, you know, we need, you know, all hands on deck here. We've talked about the fact that, you know, there are health consequences to, of course, to this outbreak, but, and the response that was necessary to mitigate those effects itself is going to lead to health consequences. But those are longer term ones. And so to make those calls about, with a lot of uncertainty in a very uncertain environment, I would say that obviously we need the people with a public health epidemiology expertise, but we need them kind of locked in the same room with the economists who can do modeling of the economy, where you bring together, you integrate the information about strategies to mitigate spread and so on with what we know about the economy and the way we think you know, it's going to evolve in order to design strategies that will balance all of these competing outcomes and objectives. And so you can't do that. You can't design something like that unless you've actually brought all of that expertise together under, you know, one roof and in one kind of framework.
And we don't want to get into a stop-go pattern of policy. You know, ease things off and then suddenly have to slam the brakes on again. That is very, very bad, both from a health point of view and from an economic point of view. So there's going to have to be a lot of careful monitoring of how, especially on the health side, of kind of how an easing process is actually working out, of what's going on.
Thank you both. So you mentioned the possibility of stagflation. Given the growth in public and possibly private debt, how likely are we to move from a very low interest environment to a very high interest environment and low growth or real decline phase by 2021, assuming the current trajectory?
Well, at the moment, you know, inflation is low, and the projections are, I think, for something like 0.5%, which is well below the Bank of Canada's target. So there is scope for, you know, the kind of policy we had referred to about printing money and having the government spend it at this time. But if, as Brian talked about, if aggregate supply, if the productive capacity of the economy remains significantly impaired, we could arrive at a situation where we've got lots of dollars chasing not a lot of goods, which could lead us into you know, an inflationary kind of picture. So at the moment, we're not facing that. And so I think the hope is that we've got a little bit of leeway in that regard. But again, it's really going to depend on how long and how significant the productive capacity of the economy is impaired.
Thank you. Many of the essential jobs rely on low-income populations to be exposed to high-risk environments during COVID-19. Example, cashiers, low-paid healthcare workers. This allows for these disadvantaged populations to continue to earn an income, but also increases exposure to high-risk environments. Could the ability to continue to work and receive income mitigate some of the risk of poor health outcomes for these disadvantaged groups? Are there any known data sources that could be used to analyze this?
Brian, you want to take this one?
It's a difficult one. Data sources on that one specifically, I frankly don't know, but it is very much a kind of area where we have to be accumulating data. If you think about the meatpacking plant episodes, for example, both in Canada and the US, what we need to be doing is watching that kind of episode, making sure that we get protective equipment into people in those circumstances. You know, when all this started, you had experts cheerfully saying the food supply chain is absolutely secure, and they seemed apparently to forget that the food supply chain depends on people actually working in places like meatpacking plants. They're no longer sounding quite so sanguine about that. But also, to be absolutely cold-hearted and statistical about it, we need to be keeping an eye on the severity to get a good handle on the real riskiness of being in those places. And again, as I say, to be absolutely cold-hearted and statistical, episodes like the meatpacking plant ones and the American aircraft carrier and the French aircraft carrier, those are going to produce some of the most interesting data from this episode. But as usual, the best data comes along after things are finished. So in the process of kind of easing up, of opening up the economy, we're going to have to revise our priors on a regular basis as we go along, and just put together as much and as detailed information from individual work sites. And that's going to be increasingly important. How risky are individual work sites? There's some work being done at the Federal Reserve Bank of St. Louis in the States, which kind of roughly, very loosely ranks riskiness of work sites based on kind of degree of contact that people in them have with their fellow workers and with the public. And we really need that kind of information to help us guide the sort of opening up process as it goes along.
Thank you very much, Brian. So we are at the end of our time. So on behalf of the Dalla School of Public Health and Institute for Health Policy Management Evaluation, I'd like to thank our panelists, Dr. Audrey Laporte and Dr. Brian Ferguson, and our host, Dr. Megan McMahon, and all of you for making time in your day to engage with us on the critically important topic of the economic implications of the COVID pandemic. Before we go, I encourage everyone to maintain physical distancing while staying safe and healthy. We'll see you at our next webinar. We appreciate your time and wish everyone a great afternoon.